Ladies and gentlemen, please join me in welcoming to the stage one of our own, Ed Salazar. Good morning, Ed. Thank you. Well, Ed, that was very powerful, I say the least, and I certainly speak for everybody here in extending our condolences and our continued good wishes to you and your family as you go through this remarkable trauma.
Thank you.
You said in the video that by current society standards, Christopher wasn't, quote, extraordinary, but yet he was extraordinary in your sense, in the sense of the family. Tell us a little bit about what you mean by that.
Well, Chris loved life. He had a strong sense of adventure. He was no angel, but he had a big heart, and he had a very generous nature. Chris was the kind of friend that if you ever had a friend that was your go-to guy, somebody that you knew that you could always count on if you needed a hand with something, somebody that you could count on if you just need a little support. You know, Christopher was that kind of a guy. He loved the outdoors. He loved athletics. He loved fishing, diving, and he loved his family. As a father, I think, the pictures that you saw of Christopher with his daughters pretty much tell the whole story there. Children are very intuitive, and they know their parents' hearts. And they knew that Christopher loved them. As a son, Christopher spent the first 12 hours of his life on a ventilator. It's kind of ironic, but he was the victim of fetal distress. So that's the way he came into this world, fighting. But at a young age, he developed a stuttering problem, and he always dealt with dyslexia. But in spite of this, he became a very good gymnast. He won gold and silver medals all over the state. At one time, he was the state champ in the vault for his age group, and he was very proud of that. We were very proud of him. He was a terrific soccer player for the various teams that he played with. He was a hell of a right wing. How many times do you see soccer players do front flips and back flips every time their team scores?
Well, I understand that he developed a passion for the Culinary Institute. That was his passion, as you mentioned earlier. He was involved, unfortunately, I guess, in a very tragic car accident. Could you lead us up to how that happened and how you were notified?
Well, after their restaurant closed, he and some friends decided that they would go to another restaurant and hang out for a little while. His accident happened about 1:30 in the morning. About 3 o'clock, I get a call from the emergency room, and the ER nurse tells me that it would be in my best interest to get there as soon as possible. I asked, how bad is it? And he said, well, it would be in your best interest to get here as soon as possible. So I get to the hospital, and the emergency room nurse is there waiting for me, and he tells me to go into this little room and wait, and that the ER physician and the trauma surgeon will be in to speak with me. Now, I know this drill. Any of us who have ever worked in the emergency room know this drill. So I knew that it wasn't going to be good. I started, get this sick feeling in my stomach, and I just literally dropped to my knees and prayed. When the physicians came in, they told me that it was very, very serious, that there was a very, very good chance that he may not survive this. But their plan was to take him into OR. They were going to put in a bolt. They're going to do intracranial pressure monitoring. And depending on what the test showed, they would decide what they would do after that. So before Chris went up to surgery, I went, stood by his bedside, and I'm looking at how terribly disfigured his face was, discolored. I'm looking at the trach tube, the blight block, the ventilator, and I'm just thinking to myself, this can't be happening.
But after these significant events and some surgery and some other care following a tragic, horrific accident, he actually was starting to recover, it appeared, is what they were telling you. Tell us about the neurological evaluations that you told me about earlier.
Well, on day 2, as the video, mentioned, he was, if you asked him to give you a thumbs up, he gave you a thumbs up. When the neurologist asked him to move fingers on the right hand, left hand, he was able to do so. So, we were very, very encouraged. We were very hopeful that, things were going to work out well for us. By the 11th day, he had been weaned off the ventilator. He, still remained trached, but, he had been completely weaned off the ventilator, and he was on a CPAP of 5, 28%, or 28 to 30% oxygen.
Well, what happened next? Now, there was some other issues just about that time, and you're thinking of he's probably going to be going home with this, and all of a sudden, something else that you didn't expect happened. Would you lead us through that?
Well, the progression from the time he got weaned off the ventilator. Now, while he was on the ventilator, I was in his night. I was in his room all night long. It was only until after he started getting weaned off that I started going home at night. I'd pray with him and then go home. But one of us, either his mother, Carol, or I, would be there first thing in the morning, and everything looked fine. Everything was going well. We were so grateful for the first responders and the job they did. We were so grateful for the ER staff, and we were very, very grateful and satisfied with the RTs and the nurses in the intensive care unit. But something happened on day 18 and day 19. April 9th was the only morning that we weren't there first thing. We had an appointment with Christopher's lawyers to set up a trust account for, we were expecting a long and arduous rehabilitation, and we wanted to be sure that funds were available to, continue to care for his daughters. So that's the only time we weren't there. I dropped his mother, Kathy, I dropped her off at the hospital. Now, she's also a critical care RN. I dropped her off at the hospital and, took my wife and my daughter-in-law home. And when I get back to the hospital, Kathy's got a very concerned look on her face, and I said, "What's up?" She says, "Well, I came in and there was something wrong. The trach tube didn't sound right." And, as I said, in the video, the therapist's response was, "Well, it's been that way all day." So Kathy had already requested a blood gas. Now, he had been doing so well that pulmonology had signed off his case 5 days earlier. So he hadn't had a blood gas in 5 days. When the blood work came back, it indicated, a compensated respiratory acidosis. And we believe that something happened with that airway at least 12 hours prior, and whatever had happened was either unnoticed or unreported.
So the respiratory therapist, in this case, it's been that way for several hours, I think you said. Did they overlook the signs of deterioration, in your opinion?
Well, the nurse's notes, everybody's notes indicated that he had been tachy all day. He had had a heart rate between 120 and 130.
What do you believe could have happened differently that perhaps would have saved Christopher's life?
Well, when you start seeing biomarkers that are out of line for someone, with a healthy heart and lungs, then again, capnography was incorporated into their monitoring system. It would have been very, very simple just to put the sensor back in line on the trach tube, and they would have known that he was in respiratory failure. Why they didn't think to do it, is beyond me. He also had one critical lab value. A serum CO2 level had been rising, and it had risen above the critical level, but again was never reported.
You mentioned that the pulmonologist has actually signed off, indicating that everything was moving in the right direction. And that perhaps you indicated earlier on, we were chatting, that maybe that bred to a false sense of security that gave rise to some complacency or some routine as opposed to this person still being critically ill. Why don't you address that, your thoughts about that?
I think that's exactly what happened. Had he been a recent admission to the unit, I'm sure pulmonology would have been called, or anesthesiology or somebody. When we asked about the trach tube and should he be suctioned, the RT appropriately responded, well, I don't want to do anything with the tube till we're sure it's in good position. So they ordered an AP x-ray. They didn't do a lateral. Mm-hmm. They only did the AP. And when the AP came back, it indicated that the tube appeared to be in good position. And then, as the video stated, the first time that they tried to bag him, the autopsy confirmed that the trach tube was malpositioned.
Well, now, you just have gone through an awful lot, and you give you tremendous amount of praise and coming up here and a lot of courage to do what you're doing, opening an old wound, but you've developed a passion. In other words, you're growing out of this something very positive. Tell us about this passion you have and why it's so important to you right now, aside from the tragedy of losing your son.
Well, to be honest with you, for the first 3 or 4 months, all I did was let my grief and my anger fester. But I became acquainted with the patient safety movement. I had written a book. Let me interject one thing real quick. There's another aspect of healthcare that we all should be aware of. If you don't know what the term sovereign immunity means, learn what it means. It's a statute that limits the financial liability of tax-assisted facilities, and in this context, obviously, it was the hospital. I wrote a book, and I titled the book "A Free Kill." And where the title comes
pretty powerful and stark title, I must say. But
well, it was
you're making your point, I think.
It was meant to be.
Yes.
When we went to mediation, because the financial statute of limitation in Florida at that time was $100,000 per claimant, and because Christopher was an adult, and he only had one daughter who was his bloodline, then the maximum amount of financial responsibility that the hospital had was $100,000. It would have cost us twice as much to bring this case to court. So when we went to mediation, and all the lawyers simply said, "We're sorry for your loss, and we're going to offer you $40,000." Well, I told them what they could do with their $40,000, and I started working with the patient safety movement. I asked my lawyer, I said, what happened? What happened in there? And he said, any lawyer that represents people who are protected by sovereign immunity, they'll never admit to this, but they'll tell their clients, in a situation like this, you have a free kill. There's nothing they can do, offer them anything you want. Mm-hmm. So you can imagine.
It's a rather sad commentary, but I can only imagine it just added further to the trauma that you and your family had already suffered. Well, Ed, here we are today. There's several hundred respiratory therapists out here, our peers. What would you say to them in terms of the take-home message from your own personal experience and also from what you've observed professionally since the horrible episode with Christopher?
Well, Pat, you pretty much hit it on the head in your opening remarks. We are respiratory therapists, right? We're not technicians. We don't just do vent checks and give aerosol treatments. Our obligation, our responsibility is to take full responsibility for this patient. We are responsible for understanding how chemistries relate to what we do. We are responsible for knowing how diagnostics relate to what we do. And we should start training ourselves to become familiar with all these innovations that are coming down the road to help prevent this from happening again. The incidence of death is just terrible. And if we as therapists start becoming aware of ways to help keep the patient out of the hospital, I know many of you have heard reduced readmissions. You hear that until you start hearing in your sleep. But it makes sense, doesn't it, that the fewer times the patient comes into the hospital, less chance something like this will happen. You know, if you don't know what telemedicine is, learn about it. If you're not familiar with remote patient monitoring, learn about it. If you're not familiar with chronic care management programs, learn about it. Every respiratory therapy department in this country should have someone in their department, a member of the Patient Safety QI Committee. I'm sure many of you are, but if you aren't, you should be. You should be involved in that discussion in your hospitals. You know, this is our time, it's our responsibility.
Indeed. Well, Ed, I know I speak for everybody in the audience and even for those who couldn't be here today who have read about this. Thank you for your courage. Thank you for taking time to come and share with us your personal insight. And there's no question, I think we've moved an awful lot of people in this audience. You put a human face on something that for most of us is very abstract only. And I want to thank you very much for being so.
Thank you.
Ladies and gentlemen, Mr. Ed Salazar. Thanks, Ed. Good.